Okay, today we're going to talk about trial goodness. You will see this if you're using CancerBot all over the place. And here's why. With CancerBot, of course, the most important thing is we want to find trials that you are truly eligible for, that match all those complex eligibility criteria. Once you have decided once you are looking at that list, we then need to say, okay, of these things that you are eligible for or potentially eligible for, which one is the best for you? So to do that, we ask you for your preferences among these four factors: burden, risk, benefit, and distance. And then we weight the score. So we'll show how we do this. This is on our blog, What Makes a Trial Good for a Patient. It's also linked to from the product itself. But so let's briefly talk about this. Burden is the patient burden of the number of visits, the invasiveness of those visits, side effects. What is this trial going to be high burden? The next item is benefit. We use ESMO MCBS, which is a European standard for scoring the clinical benefit of a particular therapy. We actually it starts at 1 to 5, but then we spread it out on a scale of 1 to 20. You'll see that we then use this in the math to compute the score. Risk, we use a number of factors. The risk of the intrinsic agent, the risk of how it's administered or the setting where it's administered, and we have a 0 to 4 scale there. Is there safety monitoring? Is there none? Or is there multiple methods? Another 0 to 4 scale. And then procedural invasiveness. So if you have to have an inpatient stay, you add for that. You add these factors and you cap it at 4. Then there's a standard of care risk. If it affects your standard of care, then that has a 0 to 4 scale. Finally, distance, we have different points for local, same city, up to 75 miles, 1 to 5. If you do regional travel, then it varies between 6 and 10. Long distance travel, 11 to 15. International travel, 16 to 20. You could sort of sum this up as the log, natural log of the distance. Then we put it all together based upon your preferences. This is the WPB as the weight that the patient has on burden, the weight the patient has on risk, the weight the patient has on distance, and the weight the patient has on benefit. Okay, so with that, let's show how this works within the product. So here I am as a follicular lymphoma. This is me living in Edinburgh with follicular lymphoma with 1 round. What am I eligible for, and what is the goodness scores? Let's go ahead and set our preferences again. You can see it's set now where benefit is the most important thing. Risk is 30%, distance is 20%, and 10 is 10%. Because I, of course, have already given it that information. Now, I'm going to restart this process. And I'm going to say, okay, you know what, I've thought about it, and I just want actually the lowest risk. And then I'm going to say the benefit. And then I'm going to say distance is the third most factor. And now I've got risk is 40%, benefits 30%, distance is 20%, and burden is 10%. And then it says, gives you a link to what the top items are, but of course you can see these trials right here. And if I go ahead and refresh this, I will. These are the trials that have higher goodness, and then these are just to show that we're not just using distance. You can actually see this one is a higher goodness score than this one that's 6 miles away. if you look at the distance, if we sort by distance, which we always can, there's several that are just a few miles away from me, that are just 6 miles away, but they don't score at the top. So if I look at this NX5948 trial, you can see it has a bunch of attributes. I am partially eligible for this, not fully eligible. I could answer more questions, and then I could potentially become. Here's another one that's quite close, with a pretty good goodness score, and this one I'm almost completely eligible for. So that is goodness score and how we compute it within the product.